Hi, Dr. Shu here from Line Plastic Surgery here in Los Angeles. Today we're going to talk a little bit about outer lip lift, and essentially what that is sort of lifting the outer parts of the lip, including the corners sometimes, to kind of make the shape of the lip a little bit more rejuvenated, and sometimes to get rid of a little bit of the excess skin that accumulates in older patients. So typically I see this request in patients sort of in two groups of patients. Some are the younger patients who just want to have a different shape to the outer part of the lip. For example, patients who say, oh, the outer part of my lip kind of comes down pretty quickly, and I kind of want to have a little bit more of a rounded look on the edge. Sort of a personal preference. I see that in younger patients, and for those patients we'll do this outer lip lift, take out some of this extra skin on top of the lip and sort of raise it up and kind of curl it outward so it has more of a rounded appearance. The second group of patients I see this in are older patients, patients for whom the elongation of the lip over time, the natural lengthening of the lip that happens over time, and sort of the natural sagging of some of the tissues that happens over time creates a little bit of either a lowering of the lip and maybe making it look a little bit shorter here, or actually some of the extra skin accumulating and covering the corners of the lips. So for those patients also, we'll do essentially an outer lip lift or a lip corner lift. The surgical procedure is pretty straightforward. The idea is to take out some of the skin just above the lip here, in this area, and sometimes over here, and essentially kind of pull that lip up so it has more of a visible appearance and gets rid of some of the extra skin. So as mentioned earlier, it's to either kind of change the shape of the lip that people want, or essentially kind of rejuvenate and restore maybe the original shape that's changed over time as the face has gotten a little older. The procedure itself is pretty quick. It's probably like about an hour and a half. It takes some time just to do it very carefully, just to make sure the markings are very specific, because we want to have a nice shape, and the lip is something that people see obviously very directly on meeting someone and seeing their face. So a lot of the time is really spent during planning. Surgery itself is pretty quick, and the recovery is pretty straightforward too. People usually don't have too much swelling in the lip area, but usually probably like about a week or 2 weeks of some mild swelling. We'll take out the stitches usually about post-op day 7, and patients can really go back to their normal activities pretty quickly. And that's pretty much it for the outer or lip corner lift. Straightforward procedure, surprisingly common actually, and pretty commonly requested here.